Hello everyone, today's video is about why it can take so darn long for H. pylori to get better. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I've had many patients over the years who have been diagnosed with H. pylori, typically diagnosed via a stool test, which to my understanding is the gold standard way to determine if someone has an H. pylori infection. It can be diagnosed through a biopsy and culture after an upper endoscopy, so like a tube down the throat basically, but a stool test, much faster, less invasive. And in so many cases, patients will have to be treated multiple times in order to get that H. pylori fully eradicated. And that can be really frustrating, especially if folks are working with antibiotic therapy, working with multiple antibiotics all at once, and need to go on multiple rounds. And in some cases, folks tolerate the antibiotics just great. In some cases, they get a lot of digestive upset. They don't feel well for X, Y, or Z reason being on the antibiotics. And so it can be really frustrating to not just clear that infection nice and efficiently, like many infections are cleared nice and efficiently. So to my understanding, one of the reasons, there's a few reasons why H. pylori can be hard to eradicate. In some cases, it's due to antibiotic resistance. But one of the reasons that I've seen in my practice, at least with the patients I've worked with, play out a number of times, is it seems to be related to biofilms. I post a lot of videos about biofilms, so I'm not going to get into the nitty-gritty of like what is a biofilm in this video. If you're not sure what a biofilm is, please cross-reference some of my other videos on my YouTube channel, or look at biofilms elsewhere. One of my colleagues and mentors, Dr. Paul Anderson, he has a very prolific YouTube channel. He talks about biofilms a lot. He's the person I've hands down learned the most from biofilms from over the course of time. But basically a biofilm, and just for folks who don't know what it is, and without getting into a lot of detail, it's a proteinaceous polysaccharide compound that's produced by different microorganisms. Oftentimes the microorganisms that produce biofilms are bacteria. Yeast can form biofilms, mold species can form biofilms, and H. pylori, it turns out, is one of those bacteria that can form biofilms. And so by creating this proteinaceous polysaccharide compound, it essentially acts like a shield or a wall that the H. pylori creates along the lining of the stomach, and it can hide behind it, and it makes it much, much harder for the antibiotics to get at it. And so that can be a reason why the H. pylori just is not able to get cleared out as efficiently as it should. Maybe a lot of it is killed off. The H. pylori that's out in the open gets killed off, but then there's enough left behind the wall where it can continue to grow and proliferate. And so the H. pylori antibiotic regimen, or maybe it's combined with natural agents as well, finishes after 2 or 3 weeks, and then whatever's left behind, whatever critters are left behind the biofilm, regroup, and then you have this persisting infection. And so it's kind of like this revolving door system. So in my experience, treating the biofilms simultaneously is really important in those cases that are recurring or very chronic cases of H. pylori. So to give an example, had a patient, a fellow in his 30s, and he had been treated for H. pylori, I think 4 or 5 times over a 6-month period, give or take. Maybe it was an 8-month period. It was just ridiculous. Like, he just was treated, got retested, kept coming back positive, usually wait at least several weeks after treatment's done to get retested. So it was just this again, revolving door system, and he was getting really frustrated with it. He didn't feel good on the antibiotics. Like, he was seeing a reduction in H. pylori symptoms, like so less abdominal pain, less heartburn, less kind of like upper abdominal distension, but it was really throwing off his bowels, causing lower abdominal discomfort, because the antibiotics were presumably throwing off his gut microbiome. So it was very challenging. So I recommended that he go on a biofilm disruptor for a couple of months alongside his kind of the last round of antibiotics that he was put on, like in this series of treatment. So he went on the biofilm disruptor while he was on the antibiotic therapy, continued on those biofilm disruptors after the antibiotic therapy was over, because and he was using natural agents at the same time, using some fairly high dose mastic gum, taking some berberine as well. And so after about 2 months or so, got retested, and thank goodness didn't have any H. pylori anymore, so it seemed to finally be cleared. So, and he was using natural agents alongside the antibiotic therapy after maybe the second, or for the first and second rounds, I think it was just antibiotics alone, along with the PPI. third and fourth rounds, he had was taking natural agents. Then the last round, so I guess the fifth round, so it was 5 rounds in total. That's when he was using natural agents and the biofilm disruptor, and then that's what finally cleared it. Now, the devil's advocate could say like, well, maybe it was just 5 times the charm and it had nothing to do with the biofilm disruptor. It's possible, but I've had other patients where they've had recurring H. pylori until we get that biofilm disruptor in the mix. Another anecdote or another clinical vignette about biofilms related to H. pylori. So this is a case where it's maybe not quite as cut and dry. It's not a recurring case of H. pylori, but it's a patient who is very, very, very sensitive to medications and like will not touch an antibiotic to save her life, basically. I mean, maybe she would take one to save her life, but she wouldn't take one to treat H. pylori. And so she was trying natural agents. She was having a hard time tolerating those two because it's a very, very sensitive individual. But thankfully, the one thing she could tolerate was Pepto-Bismol. Now, Pepto-Bismol, H. pylori, like what does those have to do with each other aside from like stomach soothing to help mitigate the symptoms of H. pylori? So Pepto-Bismol, the active ingredient in there is bismuth, and bismuth is actually a very good phase 2 biofilm disruptor. The amount of bismuth that's in Pepto-Bismol is not that high. I can't remember off the top of my head exactly how much is in a standard dose of it, but I think it's around like 100 milligrams or something like that. And normally for biofilm disruption, we usually work with, again, this is not medical advice, just for reference purposes, it's around 200 milligrams to 400 milligrams per day of biofilm disruptor. But for her, less was more, I think. And so this Pepto-Bismol she can actually tolerate it. She's been on it for months now, but it is actually making her get better and better. And like leading up to that, like she was getting no relief whatsoever, trying different herbs, just even like very gentle, like tiny doses of herbs, couldn't tolerate much of anything. And so it wasn't until we brought in the Pepto-Bismol that thankfully she was able to tolerate that. So may or may not be related to the biofilm component because bismuth does have antimicrobial properties in and of itself. But actually, sorry, with this patient, I'm forgetting one of the important details. She was actually able to tolerate pretty robust doses of mastic gum. Couldn't tolerate like berberine, couldn't tolerate oregano, couldn't tolerate any tinctures, unfortunately, couldn't tolerate herbs, even like in a tea form, which is much gentler. She was able to tolerate mastic gum actually, and she was on that for probably about 2 or 3 months before we brought the Pepto-Bismol into the mix, and she was seeing a mitigation of symptoms. It kind of took it from severe down to moderate, but once we brought in the Pepto-Bismol, that's what started to whittle it down to mild. I knew there was a reason I brought up that story, and to have some compelling evidence that there was maybe a biofilm component, because again, the dose of Pepto, maybe the bismuth in there was enough to synergize with the mastic gum to just kill off the H. pylori, but my suspicion is that it has to do more with the biofilm component. So what else was I going to say about that? Okay, well, I guess maybe that's all I wanted to say about that. So yeah, H. pylori can form biofilms. Biofilms could be a potential reason why the triple therapy, quadruple therapy for H. pylori has to be repeated multiple times, or why natural agents plus pharmaceutical agents might not be fully effective. Now, I do have to say I've treated many patients with H. pylori infections, and many of them don't need biofilm disruptors. In many cases, if they go on, say, so in many cases, the standard antibiotic therapy works really well. In some cases, it doesn't knock it out of the park, so we add natural agents in with the standard therapy, and that is what knocks it out of the park. But in some cases, even the double whammy does not quite do it, so we need to use the triple whammy, where we bring the biofilm disruptor into the mix as well, and that can knock it out of the park. So I hope this was of interest. If you yourself have had some experience with challenging to treat H. pylori or any of these treatments, I want to post in the comment section to share your experience. I know folks read the comment section, and I do too, so just interesting to get feedback from folks if you're comfortable sharing. And if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that.